Blisters. Blisters, mechanically caused blisters, they can be caused through a heat object, something hot, a hot pan or something, so here's advice to be careful if cooking or something. It can come through irritants like metal or detergent. It can come through unusually working with hands when a blister at the hand. It can come through walking with unfit shoes or new shoes or something, and here's advice to then start slowly walking in new shoes, and also change the socks if you walk for a long time. It can come through sunburns, and then that is also dangerous. And it can be also for other causes, so not mechanically caused. It can be when, for example, eczema, shingles, chickenpox, other things, herpes, simple herpes zoster, and so on. Now, normally, if just the epidermis of the outer layer is affected, it goes away within a week. If it's deeper, it takes longer, and it can leave a scar. And if it gets red around, infected or tender, then a doctor should be consulted. And it can be made a blood test. It can make a test of a fluid inside of a blister. There are also antibiotics against infections. Now, the fluid inside of it is the serum, which is the watery part of the blood. So it takes a bit of time, around an hour after the injury has occurred, until the blister forms. And a blister should not be opened, because then things can come in and it can get infected. If it is opened, here's advice to keep it at fresh air as much as possible, but only in hygienic surroundings. If dirt can come in, then it should be protected with bandages that no inflation can come in, because that can lead to an inflamed sore or an ulcer. And that is according to Keith Hodgkin's Family Medical Advisor book on the pages 91 and 92, but this is no medical advice. Hi and welcome. I'm trying to learn medicine. Today, blisters. And after we've done with, we're going to do squat training. And if you participate in the squat training, then it's at your own risk. And we're going to talk about bones, skin bones, injuries, heat burns, diseases. And this is no medical advice. I'm just reading and trying to understand it. Now, we read it already completely in the previous two parts. And now we're going to read it again. And now we try to memorize these information listed here. Blister. A blister is a swelling formed by an accumulation of clear fluid under the skin. The fluid usually consists of serum. By a blister, there is a buildup of fluid underneath the skin out of serum, which is the watery compound of blood, of a serum which is the watery compound of blood. Most blisters occur single on an area injured by heat, sunburn, irritant substances, or friction. A blister may also result from an insect bite. Where multiple blisters are present without external injury, they may result from an infection. Cold sores, herpes simplex, shingles, herpes zoster, chickenpox, and pettigo. Multiple blisters may also indicate serious diseases. We want to make a video about the mechanical, the injury caused blisters. There's not so much written about the other one, but it's written about the singular things. Blisters caused by injury. Symptoms. A blister resulting from heat, skin irritants, or friction usually forms within an hour of the injury occurring. So 1 hour after the injury occurred. And it makes sense, but the fluid has to build up first. A bubble of colorless fluid appears beneath the skin. It may grow in size after the irritation has stopped and may burst if there is continued friction. 1 hour after the injury had occurred, in general it can be faster, but in general, and there is no colorless fluid in it, a serum, the watery compound of blood, and the blister is filled with it, and it can also grow in size after the irritation has stopped, and it can burst. In particular, it can burst if the injury-causing thing is continued. A blister often forms after the pain of the injury has ceased. It may be painless itself unless it bursts. In this case, a lower level of skin or raw tissue is exposed and becomes sensitive to the air. Dirt or other irritants may get in, forming an inflamed sore. The blister itself is oftentimes painless, but when it bursts, it is again painful, because when a new level of tissue or a raw level of tissue is again exposed, and also if it is now open, dirt and irritants or infectious things can get in it and inflame. Duration. A blister formed under the epidermis, the outer layer of skin, heals within a week. If the lower level of skin is broken or infected, healing takes longer. If the epidermis, so if the topmost, if the outer layer of the epidermis is affected, a week. If it is deeper, it can take longer. Causes. Touching any hot objects such as stove or iron, or friction. For example, badly fitting shoes may raise blisters on the feet, and unaccustomed heavy manual work may produce blisters on the hand. Exposure to skin irritants such as certain detergents and metals. Touching hot objects, stove oven, for friction, badly fitting shoes, or walking unusually much, or also working with the hands unusually much. And it can be also exposure to skin irritants, detergents, metals. Complications. If a blister bursts, there is risk of infection. The blister may form an open, inflamed sore or ulcer. I don't know what a sore is. Not here. Sound therapy, speech disorders. Sores pretty good, but still not here. Smoking. Sneezing. It can make an inflamed sore or an ulcer. Treatment in the home. Avoid any further friction which may cause the blister to burst. Do not burst the blister deliberately unless the taut skin is causing acute discomfort. Opening the sore increases the chance of infection. So do not burst it, it increases the chance of infection. And no further friction. If a blister does break, expose it to the air as much as possible, but only in hygienic surroundings. Keep it covered with a bandage, however, then there are obvious risks of dirt getting in. So if it has opened, as much fresh air as possible, but only in hygienic surroundings, and if it is maybe getting a risk that dirt or something comes in, make a bandage. Keep it covered with a bandage from dirt. If a blister becomes infected, swollen, tender or red inflamed area spreading around it, then consult doctor. If blisters occur without any obvious cause of injuries, so if it's without obvious cause of injury, or infected, swollen, tender, red inflamed area spreading around it. And there are antibiotics if a blister has become infected. It is possible to take a blood test if there's no reason found. And maybe also a part of it. A part of the skin or just a blood test or the fluid. Take care when working the feet, when cooking or ironing, for example. Wear protective gloves for any heavy metal work to which you are not accustomed. Avoid badly fitting shoes and break in new shoes with only short periods of wear. Put on thick socks to prevent chafing on a long walk and change socks on a long walk. Initial periods of exposure to sun or ultraviolet lamps should be very short, only a few minutes, and should be increased very gradually. Outlook. Most blisters form only under the outer layer of skin and heal completely with or without treatment. Occasionally, a severe blister may affect the whole thickness of the skin. It will also heal completely but may scar. Usually blisters heal completely within a week if it's the epidermis, otherwise a little longer. Severe blisters can also leave a scar. And there can be also blisters from skin disorders. We're not going to talk about that, we're only going to mention it. Skin disorders which may cause blisters include eczema, erythema multiforme, a rare but harmless skin disease, pemphigus, and shingles. The shape and distribution of the blisters vary according to the disorder. However, they are generally multiple, unlike the isolated blisters caused by burns, irritants, or frictions. It can be blisters also out of other reasons, for example, eczema, erythema multiforme, eczema, erythema multiforme, Firmicus, pemphigus, shingles, eczema, shingles, pemphigus, erythema multiforme, erythema multiforme, herpes zoster, herpes simplex, chickenpox, and pedigo. Do I know all the information? So blister is the fluid fit, is the serum, the body part of the compound. Goes away within a week. If it's deep, it can leave a scar and take longer. It can come through heat, so take care of working with heat. It can come from working with the hands. It can come through irritants, metal or detergents. It can come through sunburns. And it can be also other causes like eczema or shingles, have simple zoster, chickenpox, impetigo, and something else. Don't open it. If it gets red around, tender, infected, then consult a doctor. It can get infected if it's opened, so do not burst it. Should go away within a week. There are medications. It can be a blood test, the test of the fluid. I'm going to stop a second now. Blisters. Blisters, mechanically caused blisters, so they can be caused through a heat object, something hot, a hot pan or something, so here's advice to be careful if cooking or something. It can come through irritants like metal or detergent. It can come through unusually working with hands when a blister at the hand. It can come through walking with unfit shoes or new shoes or something, and here's advice to when start slowly walking in new shoes, and also change the socks if you walk for a long time. It can come through sunburns, and then that is also dangerous. And it can be also for other causes, so not mechanically caused. It can be when, for example, eczema, shingles, chickenpox, other things, herpes, simple herpes zoster, and so on. Now, normally, if just the epidermis of the outer layer is affected, it goes away within a week. If it's deeper, it takes longer, and it can leave a scar. And if it gets red around, infected or tender, then a doctor should be consulted. And it can be made a blood test. It can make a test of a fluid inside of a blister. There are also antibiotics against infections. Now the fluid inside that is the serum, which is the watery part of the blood, so it takes a bit of time, around an hour after the injury had occurred, until the blister forms. And a blister should not be opened, because then things can come in and it can get infected. If it is open, here's advice to keep it at fresh air as much as possible, but only in hygienic surroundings. If dirt can come in, then it should be protected with bandages that no inflation can come in, because that can lead to an inflamed sore or an ulcer. And that is according to Keith Hodgkin's Family Medical Advisor book on the pages 91 and 92, but this is no medical advice. I don't know if I wrote something. Maybe one or two things. I'm going to stop the camera. And that was the medical part. If you're here for medicine, you can go directly to the next part of medicine, where we're going to continue with the next thing there, whatever comes after BL or something. If you stay here and participate in this squat training, then it's better the August. One leg up. Yeah. And take a leg at the ankle. Tuck the tailbone in. Other leg. Point with the knee onto the ground. And tuck the tailbone carefully in. One leg to the side, the toes are pointing in front. And we're stretching the inner side of the leg. Over to the other side. And go from side to side. The Mentis exercise. Back in the middle. And now, legs wide apart, and we're doing 12 squats. Number 1, 2, and 3. And we're having 1/4. Number 4, a third. And 5, and with 6, we're having already a half. And 7, and 8. With 9, we're having 3/4. Number 10. And the last 2, 11 and 12. And now the 6-pack squat squeeze exercise. Down into quarter squat. And press against the top part of the leg just on one side. And on the other side. Down into half squat and press in the middle of a leg. And on the other side. Down into 3/4 squat and press close to the knee. And on the other side. And up again. And now the fastest giraffe of the water pond. Down into 3/4 squat, press against the leg and go towards it. Other side, press, go towards it. 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 2 more. Press, go towards it. Press, go towards it. Last exercise, the propeller. Down into foot squat, arms to the sides, over to one side, press against the leg, look up to the head. Middle, over, press against the leg, look up to the head. And up. And one heel onto the ground, pull the toes in. Foot to the left, pull the toes in. To the right, pull in. Middle, move from left to right. Upper heel, pull in. To the right, pull in. Left, pull in. Middle, move from left to right. One leg up. The other one. Take the leg to the ankle. Other one. Next out, breathing out. And out. In and up. Out. Breathe in and close the legs. And breathing out. It was a squat training. I thank you very much.